Okay. Good afternoon, everyone, and welcome to the Clinical Trials Network Best Practices Writing Series. I'm Rebecca Taff. I'm an editor with the Communications Department at DCRI, and today I'll be sharing with you some information about writing abstracts, both for biomedical manuscripts and for scientific meeting manuscripts. We'll begin by just defining the abstract. What is an abstract? Well, here are a lot of definitions, but actually an abstract can be all of these things. It can be a persuasive tool as well as an informative document, a kind of summary, a brief presentation of a broad topic, or a paper reduced to its bare bones. If you look at the last four bullets here, these definitions really pertain to abstracts for meetings more than for biomedical manuscripts or biomedical abstracts for manuscripts, because usually in scientific meetings you may be presenting preliminary work, you may be presenting work that's just underway, and so it would be appropriate to make a concise statement to orient a reader to the current state of research in your field and what you're studying, or just to describe an experimental approach that you're about to undertake, or the preliminary results of a clinical research study. And you can also give a resume of the results and conclusion of a study if you've previously presented your preliminary work to that same meeting. And then it can be a statement distilling the significance of the work and its implications for future research in the field. So what is the purpose of an abstract? Really, at the heart of it, the purpose of an abstract is to attract a reader to your paper and make them want to read your manuscript or to be more interested in your presentation at a scientific meeting. But abstracts really serve a lot of purposes. In terms of breaking them down into meetings and manuscripts, obviously for a scientific meeting, when you submit an abstract, it's going to be reviewed by someone who's reading hundreds of abstracts that are presented for that meeting. So you want to really make it succinct, make it sell, make it interesting, make it appropriate, give it brevity, adhere to the good rules or the rules of good writing, and you want them to be able to discern what's going on with your study immediately. So it's important for meetings to write a really good abstract. It's important certainly for manuscripts, and for the kind of manuscripts that we primarily write here, which are clinical research studies, you want that abstract to be really a mirror of the scientific paper that it represents. And so if you're submitting your abstract and your manuscript with it to a biomedical journal, usually the person who's reviewing that will be the editor-in-chief, who is a busy clinician or scientist. He or she may spend 4 to 8 hours in the editorial office per week. And I know from working on a journal and from being in journal offices that usually these people have only time to read the abstracts to determine whether the paper will actually go to peer review. So it really should be a good mirror of the document. And I know that having worked with scientists over the years, scientists and clinical researchers, often they will work for hours tediously to make a manuscript letter perfect. And then they'll say, oh, it needs an abstract, and it gets slapped into place as an afterthought. So I want to impress on you that the abstract is really the part of your manuscript when it accompanies a manuscript that will be read by more people than anything except the title. So it serves a lot of purposes. And then, of course, online, and we'll go into that a little bit. when your abstract goes into Medline, it's going to be even more important for people who are trying to do a review of the work in your field, and they need some quick access. So abstracts promote current awareness. Every educated person has an ethical responsibility to keep up with the research or the literature in his or her field. And more than 40 years ago, in the Journal of Clinical or Chemical Documentation, was this statement: in most technical fields today, the thoughtful scientist views his obligation to remain well informed with a sense of acute personal distress. Well, if that was written almost 40 years or more than 40 years ago, imagine how true that is today. In 2003, I read that there were more than 30,000 biomedical journals being published. And so if you consider the articles being published out there, there were several million at that time. So from a strictly clinical perspective, much of what is published doesn't require the attention of an individual clinician because it's too redundant, it's too preliminary to warrant a clinical action, and it doesn't really address questions of direct relevance to the reader. And the amount of reading required is reduced, but the formidable task of extracting the pertinent literature still remains. So abstracts are required by our need to keep informed. They save reading time because if you consider that a 200-word abstract is representative of a 2,000-word paper, then it really saves a lot of reading time if you're trying to get to the meat of the document. You could say that abstracts save about 9/10 of the time needed to read an original document. And certainly, this is not to say that primary documents aren't important. They are important because they constitute an archive. They have to be preserved. And you want someone to read your original research if that's their field. But for the purpose of getting data, findings, and conclusions and putting them to prompt use, an abstract serves a wonderful purpose. They facilitate selection. Obviously, if you just went through titles and Medline to determine what to read, they wouldn't be very useful. So I would say if you're writing even a type of manuscript that may not require an abstract by the journal, that you should submit one anyway, because it may appear on Medline and it may lead readers to your research. So abstracts do facilitate literature searches. Really, without indexed abstracts, a real review of the literature would not be possible. And they overcome a reading barrier, because if you consider that medical manuscripts are written in about 70 languages, then if you narrow them down and translate them into one or two common languages, there's a greater amount of communication. And this is what happens with a lot of abstracts, even if the original article is not translated. They improve indexing efficiency because most of the major keywords in an abstract will also appear in the document, and they should if it's a real mirror of the document. So if you want to save indexers a lot of time, write a good abstract that really mirrors your document. And then, of course, they aid in the preparation of reviews. They're especially helpful in preparing bibliographies, because if you've got a large number of documents written in several languages, and lack of ready access to them, it's going to be impossible to really review the literature. But abstracts save that time for you. So if we're talking about abstracts for biomedical manuscripts, there are really two different categories. One is what I call the indicative abstract, which can also be called a descriptive abstract. And it's written really for special types of papers, such as review articles and case reports. And it contains general information. whereas an informative abstract is one that's more comprehensive, and it contains a lot of specific information and details of data, and this is the type of abstract that we write for most biomedical research papers. So the indicative abstract really just amplifies a title, and it describes really more clearly the contents of a document. Its function is really to alert the reader to the contents of an article, and it acts as a guide to, but not a substitute for the article. Its content indicates the scope of the document, what was done, why, and how, but it usually doesn't present results or conclusions, and that's because it's not really written for a research paper. It's written for another type of document, and we'll look at that later. Its length is shorter. A biomedical paper's abstract will be generally 200 to 250 words, whereas an abstract for this type of document for a review or a case report will be more condensed, about 100 words. And its style is usually characterized by the passive voice. So here's some examples of indicative abstracts. A review article. Here's one that has only 2 sentences, but it serves a purpose. A review with 61 references on agents relevant to anesthesia, especially those introduced in the last 3 years. So it's a sentence fragment, and that's acceptable here. In addition to anesthetics, hypnotics, neuromuscular blocking agents, adjuvant agents, and beta-adrenergic agents are discussed. So it tells you exactly what's being discussed in the review article in just 2 sentences. Here's a little bit longer abstract, but it again is only 2 sentences. This one is for what I call a how-to-do-it article, and it's giving techniques for surgical techniques for implanting a type of circulatory assist device called a hemopump. So the first sentence tells you exactly what the article will contain. Techniques for implantation of the hemopump, an intra-arterial axial flow circulatory assist device are described. Again, we're using the passive voice. The hemopump is currently undergoing clinical investigation, and then they go on to tell you what it's used for and what clinical situations it's used in. So that's very effective for that kind of surgical technique article. Another example of an indicative abstract, as I mentioned, is for a case report. And I can't say how important it is to write an abstract for a case report or a brief report, even though journals don't necessarily call for one. And this is because people who are looking at, say, a rare condition or something that is unique to their research, and they want to actually count the number of articles that have been published on that topic, will go to Medline, and if they see a title, they're going to have to wade through, try to find a case report. It may not be on Medline in its full document form. So it's real important to let readers know that this is a rare case and this is what we found. So here they're talking about the fact that renal transplant patients often, they survive for longer periods, but they often have abdominal aortic aneurysms. And so these researchers are looking at this type of patient, and they have found that there have been 15 reports of these types of aneurysms in renal allograft recipients. And that's what they tell the reader. So they put it in context and say how important and rare it is. And then they say what they're doing, describing a 16th case. Moving on to informative abstracts, which I also said can be more comprehensive and represent a biomedical research paper. They're really designed to distill significant information in a document. So when I use the word mirror, I really mean that. Everything that's pertinent that appears in the article should also appear in the abstract. And another caveat, and this is a problem that I see quite frequently with beginning writers, is they'll introduce some information in an abstract, And they act as if the manuscript is a continuation of the abstract. But really, the abstract is separate. It may be published together with the manuscript, but all the information that's contained there, all the keywords, all the what was done and what was found, etc., should be included in the abstract and repeated in the manuscript. So they're not something that's a continuation or a flow. The other thing to remember is when you introduce terms like acute coronary syndrome and you spell out the term and then you define it, give it an abbreviation in the abstract, you have to do that again in the document. So when you're writing a research paper, treat it like a total entity, and it's probably good to write the abstract when it's done. But as I said, don't write it in a hurry. Really take care in writing it and make sure it's good. Another question I've been asked in the past is, can an abstract actually contain information verbatim that's in the manuscript? And I would say yes. It's probably a lot more interesting and readable if they're published together, that it'd be a little different, but it's certainly acceptable. If you're having some writer's block and you've written a good paper, you can extract some information from that for your abstract. So it condenses the basic information of the article. It indicates what was done, including why and how, and I might add here when, because it's really important to say when you did a study or for what time period a study was conducted, and include that in the abstract, what the results were and what was concluded. And its length should be longer, and please consult the journal to determine their word length, because as I told you, an editor-in-chief is probably the first person who's going to determine whether that article is acceptable to go into peer review. But most large journals also have what they call a manuscript checker. And so that person will see the documents that come in, and they will check against what the journal's requirements are, one of which is to have an abstract in a certain length. And there's a reason for this, because they have limited publishing space, and Medline used to actually truncate abstracts after a certain limit. And I can't tell you how many times I've gone on Medline and I'll be reading along and get to the conclusion and it's chopped off. So be sure to follow their requirements. And actually, it could delay publication if your abstract is too long. It may be sent back to you. So you just want to be sure to follow the journal requirements. So when we look at the organization of an abstract, we really use this acronym that is used by journal editors for biomedical manuscripts called MRAD. And that stands for these things: introduction, methods, results, and discussion. These are really the bones, or the backbone, or the pertinent information that will be contained in an article. So based on this format, the abstract should have the same key subject areas or specific sections. One is the introduction, and you'll see that it's a little different in an abstract, but you want to tell the reader why you did the study. And the why of the study is really the hypothesis or the research question. Why did you do this research? You want to let them know up front. And when you're writing an article, everything hinges around the question of the research. The methods are done to answer what you did to find out, the answer to the question. The results are really, what was found after you did this research. And then there's an answer in the discussion. So an abstract is very similar, but you could use a different acronym. I call it PMRAC. It's instead of an introduction, you'll have a purpose statement, which will state the goals and rationale for the study and why you undertook the study. And then the materials and methods, results, and conclusions will follow. And for every method that you describe, both in the paper and in the abstract, you should have a result for that method. So I think I mentioned this later in this talk, but the method section should really be written either in a chronological order, say if you're doing a lab experiment, and even if you're doing a clinical research study, you can write in chronological order what you did, or you can write the most important thing that you did if you have limited space, as you might have for a meeting abstract. And then for everything that you list in the methods, you want to have a result. So what were the clinical data? What techniques did you employ? What are the names of the drugs, their strengths? What were the regimens or regimen for the study? How many subjects did you look at? What was the treatment plan? How long was it? And this seems like a lot, but you actually can get it all in there. We'll look at some examples later. And then, of course, what were your important findings? Was the drug safe? Was it efficacious? Did it have adverse effects? And what were the statistical outcomes of the study? You would put in the methods what you used to determine that, and then what you found and what was most important. And then you will have the conclusion, of course. What are the most important things you learned, and what are the recommendations? And as you can see, I've got percentages listed here, and the percentages are actually the weight that you would give to each of these sections. You want to have a concise purpose statement and a concise conclusion, but then you want to give the weight of the abstract in the materials and methods and the results, because you've got a lot of information to present there. And I might mention this is also what you would do in the regular manuscript. Probably give the same percentage of weight to those sections. So here's an example of an informative abstract. This is an abstract where they're looking at a new device to measure certain pressures in intubated infants. And so what they do here is name the device. If you look at the keys on the left, they name the device, which is a flow meter. They give its purpose to measure all these pressures, and then what population they use this device in. And then in B and C, they give the key features of the device. It's light, how much does it weigh, it adds minimal dead space and resistance to an infant's airway, and so on. And then what is the advantage of it? It's really valuable for evaluating mechanical ventilation in low birth weight infants. And then how is it tested? And this is a little different because the emphasis is really on the device itself. So you're not giving the population up front. You're giving it in the latter part. So they looked at 50 infants in 125 studies, and then they conclude that it accurately measured a wide range of tidal volumes. So I think that's a real good example of a succinct informative abstract. Here's another example where they're looking at comparing a Swan-Ganz catheter and how it measures left atrial pressure in patients with heart disease with a transesophageal echo device, and they're using it in surgery. So their premise or their hypothesis is we want to look at a less invasive way of measuring pressures in patients who are at high risk and have heart disease. And so they go on to say what the purpose was. They determined whether pulmonary venous flow and mitral inflow assessed less invasively by pulse Doppler echocardiography can accurately estimate mean left atrial pressure. They go on to say how many patients they studied it in, and it's important that they say they studied it in patients who were undergoing surgery, because as you may know, transesophageal echo can be used in a lab where it would be not very pleasant and pretty invasive, but in this case the patients are sedated. And so it definitely is a less invasive way to study these pressures. Then they go on to say how they correlated the pressures, and they did it simultaneously. What was found? We found the most strongly correlated pulmonary venous flow variable correlated more strongly with mean left atrial pressure than the most strongly correlated mitral inflow variable. So they're really saying that in looking at transesophageal echo, they're finding that it has some requirements or some advantages, I guess, over the other method. So they're saying that in a very succinct way, but a very detailed way. And I want to mention something else, too. I've underlined some terms here. Left atrial pressure is really a key word here. And so what you want to do as a writer is emphasize in every section of your abstract what the key terms are. And not only that, you want to signal the reader, probably in more active voice, to what you're doing, to signal them to, okay, if you're writing in paragraph form, for instance, you want to signal them to say, okay, now we're going on to the methods. So to determine signals then that you're going to the method section, and then we correlated. That's a method. We found that signals the reader that you're talking about results, and then when you get to the conclusion, we conclude, again in the active voice, not something was found and something was concluded, because you're actually actively doing this research, or it's been done. So you want to bring the reader into that action of your study. And so this is a lot more effective. And then, of course, there can be an implication in the, what does it mean part of the abstract. We suggest this technique may offer a relatively non-invasive means of estimating mean left atrial pressure in patients with heart disease. Very succinct conclusion. The structured abstract is something that, well, it's a format that was developed, I would say, about 12 years ago, maybe longer, in the early 1990s. Some of the general medical journals especially adopted this format because they thought it would make information more easily obtained and gleaned and reviewed and make the abstract more informative, more succinct, whatever. So a number of journals jumped on the bandwagon, and they were all printing these structured abstracts. Well, I was working in the field of cardiovascular medicine then, and I just hated it. I thought, this is just terrible because it takes away the whole creativity behind writing an abstract, and it makes it just not fun to read. It's just a lot of information put often in sentence fragments. But then I could see some advantages of it as I went along, and I worked with authors who were using this format. One advantage is it kind of forces you as a writer to put the most important elements of your study in there. So if you're writing and you're writing in paragraph form, you may overlook something as important as your patient population. And so this kind of forces the writer to put everything pertinent in there. And it also contributes to doing a systematic review of the literature. But as we found over the years, there are some flaws in that system. Here's an example of a structured abstract. I just wanted to show you this, just to show you how it plays out. But here's what I'm talking about when I mention a caveat for this format. The Journal of the American Medical Association is one of the journals that adopted this format and still uses it. And someone did a survey of one issue of JAMA and found that this many types of structured abstracts were used within that one issue. So if someone is really doing a systematic review of the literature, this is not going to be helpful because they're going to be looking for key areas that will be listed in some abstracts and not in others. So I can say that it has its pluses and minuses, and I don't know how in the future it will play out, but that's kind of where it stands today. Some journals are still using it, mostly general medicine journals. But more frequently, you're seeing this form, and this is a form that a lot of the journals that I work with use, where they have just these 4 major headings: the background or purpose statement, methods, results, and conclusion. And you'll find in journals like Circulation, and here's an example of an abstract that was recently published in that journal. They will combine the methods and results. And you want to be sure, though, to list all your methods and then all your results, as you would do in the other format, and not mix them up, because this confuses the reader. But in this particular abstract, and I think it's a real effective one, they're looking at whether fatty acids in fish really have antiarrhythmic properties. So they take 2 patient populations, and they give one of them fish oil and one of the study groups olive oil, and they test whether, in looking at primary endpoints, of whether those patients who had ICDs or cardioverter defibrillators actually required treatment sooner than in one group than another. So this is a good example of the kinds of studies that we might do here in comparing 2 different groups. And then they go on to give the p-values, and this is important too, certainly to list what the primary endpoints were of the study and what was found, what statistical method you used to find it, and then how it ended in that study. And so what they found was that there was a trend toward improvement in the people that they gave the fish oil. And so they give a p-value, and it's p.057, which is close to being significant, but not. So it's important to give an exact p-value in this case. And then they go on to say that they didn't achieve significance. They admit it. I mean, don't try to cover it up and say, oh, it was pretty significant or it was almost significant. It wasn't. It was, it was not achieved. But there is evidence that it can be a useful treatment, and so more research obviously needs to be done. So here are some guidelines when you're writing an abstract for a biomedical manuscript, and some of these apply to all types of abstracts. You don't want to use abbreviations or symbols other than standard. Think about your readership and what abbreviations are standard in the field, and certainly when you work in an institution like DCRI, you have hundreds of abbreviations and acronyms at your disposal, and they're used frequently on a daily basis. But think about whether those abbreviations and acronyms are unique to your organization, to your group, and whether they would be understood. Just try to put yourself in the reader's place. Don't cite references in an abstract. Really, an abstract should represent your original work, and so it really shouldn't require a reference. And you shouldn't have tables or figures in there, just text. And as I said, no information that's not contained in the text. Don't introduce a finding or something you did in the study in the abstract, and if it's not important enough to be in the primary document. No jargon, and you all know what jargon is. It's, like stat and whatever you use in your clinical work. And no words coined by authors. And I'm sad to say that a lot of words that are being coined by authors are creeping into the dictionaries and into standard formal use. But one of those is biopsy, which turned into a verb some years ago, and it wasn't in the dictionary. And I worked in the field of oncology for a while where that term was used quite frequently, and we were just adamant as editors that we wouldn't impose this as a verb. A biopsy was performed. Patients weren't biopsied. Well, now, lo and behold, here it is in the dictionary. and it's acceptable. And sometimes just frequent use and communication and understanding of a term will let it wend its way, I guess, into the formal usage. Another word, and I just looked this up the other day because I was hoping it wasn't in the dictionary, is the term incentivize, which is really a business type word, which probably a lot of terms we use in medicine, and medicine is partly business. A lot of these terms have crept into the medical literature, and I used to just strike them out and change them in any way I could. But unfortunately, incentivize is now an acceptable term. So, as I mentioned, you want to follow the specifications of the target publication, both for format and length, and always check your word limit, which is really easy to do when you're working with Microsoft Word. So let's move on to talk about abstracts for meetings. As I said, the guidelines are really similar to those for manuscripts. You would describe your work in the...
You can just leave it there. I know it sounds louder.
Oh.
But that's, people are having trouble hearing.
Oh, okay. Okay, thank you. The guidelines are similar to those for manuscripts. You would have an introduction describing why the work was done, and obviously you state the research question or the purpose of the study. The methods, which would include the population study, the techniques used, and how data were analyzed. And then here are the differences in meeting abstracts. You want to summarize the important findings, but you can use a table or graph to illustrate the findings. And it's really used, these techniques, I guess you would call them, or illustrations or supporting material, are really used to emphasize the results and to allow someone to put a lot of data in there that wouldn't be readable in a text format. But you have to remember, if you're using a table or graph in a meeting abstract, that you make it large enough that it can be read or seen, because one of the real problems I've seen in abstract booklets is that you've got a graph, but you have to use a magnifying glass to see it. And so usually I think the rule is that it should be at least a third the size of the overall document. And so also remember, when you're using a table or graph and you've got your data there, don't just put it there and think that the reader's going to know what it means. You have to summarize what the data mean. You still have to have a sentence to support what that supplemental material represents. And also abstracts for meetings, because sometimes they are preliminary work, can include a statement of implications of the findings of the study. Now, this is okay in some manuscript abstracts, but it's really very acceptable in meeting abstracts, and there's a difference. So for meeting abstracts, again, do not use a lot of abbreviations. And we see more abbreviations used in these types of abstracts because the writer is trying to condense everything to fit in that little form that's on the submitter, on the online submitter. And as you all know, if you've used these submitter forms, once you run out of room, well, that's it. You can't get any more information on there. So abbreviations are just rampant in these abstracts, but I'll show you in a minute how they really take away readability. So you really want to limit them. And then you want to not include a legend as you would in a manuscript for tables and figures. As I said, you would have a statement to describe what they mean, what the data mean, but you don't have a legend. That just takes up room and it's not necessary. And the last bullet here just summarizes what I said. Don't omit the statement of results that they support. So we're going to look closely now at some common problems that are seen in all types of abstract writing. And these are really just rules of good writing, and I want to show you how, and you know, you're really communicating, and if you have a lot of incoherent sentences and a lot of abbreviations and acronyms, somebody's just not going to read it, frankly, and it may not pass muster getting through a journal or getting through a meeting. So lack of sentence clarity, poor organization, non-coherence, excessive detail. Choose the most important things you want to present and include those. And then failure to consider non-specialist readers. So here's some just illustrations of how sentences can lack clarity. In a meeting abstract, I see this a lot, where the writer starts out with a method, but they don't give a purpose statement. And they think, well, we know, it's clear to us why we do this research, but, you all should understand this, so we'll just start, because we don't have room to write that purpose statement and that background and all that, so we'll just start out telling what we did. So the reader is left to figure it out. And trust me, this is seen more often than you would imagine. And this is why it's good sometimes to have those structured type abstracts, because then they're forced to put a purpose statement in there. A question might be vaguely stated. You want your hypothesis or purpose statement to be really clear. Why was the study undertaken? And then sometimes they give the results and they're like, oh, great, these are our results. We know everybody will understand what they are, but not necessarily. So here is an example of a sentence, an abstract. I extracted this sentence from an actual meeting abstract booklet, and this was the very first statement in the abstract. I won't bore you with reading all the details, but it starts out with bovine aortic endothelial cells in culture were pretreated with these two agents in culture medium and then washed and harvested. And they've got a nice little abbreviation there for the bovine cells, which I don't think is standard even to people who work with bovine cells. But you go on and read this abstract and you don't know why in the world they did this. So this is an example of why you don't want to omit the question at the beginning. And then another common problem is just an unclear message. Maybe you do state the question, but it's vague. And maybe you state sort of an implication, but it's also vague. I think I'm going in the wrong direction here. So here's an example of a question vaguely stated. We studied plasma cholesterol metabolism. Okay, good, but why? Better to say we examined whether cigarette smoking causes abnormal metabolism of plasma cholesterol in young men. So you want to be sure to say what your independent and dependent variables were, and not just say what you studied, but why, and what you were looking at to see if it changed. And then another common problem is, and this is from the same abstract, is using a pronoun like this, that, these, those, a demonstrative pronoun, and assuming that the reader knows what you're referring to, when the antecedent is not clear at all. Maybe it follows some sentences down in the abstract, and as an editor, I've had a hard time figuring out what they're referring to sometimes, especially if I'm not that familiar with their work. So you want to say exactly what this is. Try to avoid using it. Our data indicate that cigarette smoking causes abnormal metabolism of plasma cholesterol in young men, which could explain blah, blah, blah. Much better. And then you want your sections to be ordered in a clear, direct way, as I mentioned, and you don't want to mix up the content. Now, here's another sentence I took directly from an abstract that was published in a meeting abstract booklet. And as you can see, it's just non-coherent because of several reasons. They use abbreviations, they use numbers, and some of these abbreviations, they're too many for one thing. They're not standard abbreviations, at least they didn't seem that to me, and it was the field in which I worked. AVN is for AV node, and HV is his bundle. So they're talking about an anti-arrhythmic study. But you know, it's real difficult when, even if you read a clear purpose statement and you read a clear method section, and then you're like, oh, what did they find? What were they finding in their results? And you look and see this kind of statement, just really hard to figure out. So don't put too many abbreviations. And then there's the use of the word respectively that people use. Writers use this as a tool so they can stack up a bunch of variables and then stack up a bunch of percentages that they found in the results that match those variables, and it's left to you, the reader, to figure out what goes with what. So using respectively, here's an example of another published abstract in which they used respectively, and they listed a group of variables, and later they listed the percentages that match those. So I took the liberty of rewriting this last part of this sentence to show you how much clearer it can be, and it really actually saves a lot of space if you write it succinctly in the first place. So rather than stacking these up, you can just say an MD here is medial dissection. Occurred in 0.3% of patients, AC in 0.7%, emergency surgery in 2%, MI in 0.6%, and death in 0.2% of patients. So it's very clear now what the findings were. So another common problem is reporting data for all your results when you're limited in space. And this is really what leads to this issue of having too many abbreviations and too many stacked abbreviations and variables and all that. So look for the most important results if you're limited in space. And if you've got a well-known technique or study that's behind the experiment you're doing, you don't have to describe that. Look at what's most important and what the reader needs to know. If you provide exact data, well, that has a place in the primary document. But in an abstract, you might just want to say what the comparison was and what the percent change was to give them a real sense of what you found in immediate sense. You don't want to give p-values over and over. Just choose the important ones and give them once. And, of course, you don't have references unless some meeting abstracts actually do permit them, but very brief, maybe only a few. So here is an abstract, and I don't expect you to read this, but I want to point out some important things. This is a published abstract that appeared in the circulation supplement for the American Heart Association meeting in 2004. And I'm not trying to be derogatory or anything to malign the authors of this. It's not a really bad abstract. I mean, you can glean the important information from it when you read through it, but it has a lot of little errors in consistency, and I think errors in general, good writing, that I want to point out to you. And before we move on to just looking at some of these sentences in their entirety, I wanted to point out a few things I saw in just looking through this. One is that they use ACS as an abbreviation in the background, but then they define ACS later after its first use. So you want to define acronyms or abbreviations at their first use. They also have inconsistencies in the way they use terms, like endpoints is 2 words in some places and it's 1 word in others. They list primary endpoints and their methods, which is appropriate, but when they give the results, they list a composite primary endpoint rather than 5 or 6 endpoints. So the reader's left to be confused about what the primary endpoint actually was. They also define, and we'll look at the title, but you want to define what early and delayed is up front, probably at the first use. Was it less than 24 hours, later than 24 hours? As long as you tell the reader up front what those terms mean, maybe in your background statement or your purpose statement, you don't need to repeat those later in the document, unless maybe in the conclusion you want to emphasize that. So those are just a few things of several I found. So let's look at this in some detail. Starting with the title. Here's the original title. Early, within 24 hours, statin administration in patients presenting with acute coronary syndrome is associated with better outcomes compared to delayed after 24 hours administration. Now, I don't think they spent a long time thinking about this title. It serves a purpose. You can figure out what it means. It gives the information you're looking for, but there's several rules that they sort of didn't obey here in terms of writing a good title. One is you don't want to define your terms in the title. You want to define the terms in the document itself within 24 hours and after 24 hours. I think they did this because they had limited space in the document, so they were using it in the title, but still not a good idea. And also in the document, you could just use a greater than or less than symbol. That's perfectly acceptable if you don't want to use up space. Remember that the verb, this is just a little editorial thing that, you know, it's one of my pet peeves. A verb is actually a real important part of a title. So you always capitalize the verb, which they didn't do here. And if you're comparing things, you're comparing early and late, you want to put those close together. They've got early in the first part of this long title and delayed at the very end. So the reader's left to go, okay, what are they comparing? Oh, early up here and late. It's just, you know, as I said, you can figure it out, but it just takes a little longer. So you might revise it to say something like early statin treatment is associated with better outcomes in patients with acute coronary syndromes. And I'm not giving the comparison here because I don't think it's absolutely necessary. What is necessary is to give what the key finding was and attract someone to read that abstract or article. Then in their opening statement, now spell check is great, but it won't take the place of editors. They start, and this is the important keyword of their study, and it turns out to be stains. So they've got a big fat typo in the first word in the first sentence of the abstract, and it's published the way you send it in, so that, you know, no copy editor is going to come behind you for a meeting abstract. So they're saying that stains are used for lipid-lowering effects, and we all know that's probably not true. And they also have other beneficial effects. So revised, you want to say statins are primarily used for lipid lowering, but are also beneficial for their anti-inflammatory effects, and make it a little more concise. In the purpose statement, it's a little wordy. You don't have to say the purpose of this study was. First of all, it's passive voice. It takes up a lot of space, and it's just kind of a dull beginning. So I just changed that to say, and again, well, two things here. They're saying earlier administration of the statin, but in this case, they didn't define what earlier was, and it's very close to the beginning of the abstract. So you want to say what earlier means here. This is the appropriate place to put it, and they've already defined acute coronary syndrome earlier in the document, so you don't want to define it again. And when you do define it, you don't want to use brackets. It's appropriate to use parentheses first and brackets inside parentheses. Just another little rule of punctuation. So it would be much better to clue the reader into what you're doing. We sought to determine whether earlier administration of a statin, what is earlier, within 24 hours of hospital admission, improves outcomes in patients with ACS. Then in the results, another kind of wordy sentence here. The incidence of the composite endpoint of death and stroke. And as I mentioned earlier, they didn't say in the primary endpoints in their methods that there was a composite. They gave several different outcomes, including heart failure. So you're going, when you read this, you're going, what? And that's a flaw. And then they give results. The incidence of the composite endpoint of death and stroke was 7% in the early group versus 10.4% in the late group, and then they give a p-value. It would be better to put the comparison of the percentages together so you can really make a comparison and capitalize the p-value as this journal does. So there was a lower incidence of death and stroke in the early administration group than in the late group. And here, instead of giving exact percentages, they don't say in the original verse or original sentence whether comparison is, they just give exact numbers. This is what I was talking about earlier. If it's higher or lower or the same, you want to give the reader that. So that's what I tried to do here. Just tell them there was a lower incidence of the primary endpoint in this group than in this group, and then give the percentages. And then in the conclusion, they give, instead of the primary endpoint, they give all the other endpoints. Or instead of giving the composite, they give the other endpoints, which they've led you to believe, or, I mean, well, they've just confused you throughout. So, again, they're comparing early with delayed administration, and they're repeating that it was in the first 24 hours, and it's just a cumbersome statement. So I think it would be better to say patients with ACS who receive statins within 24 hours of hospital admission had a lower incidence of whatever the endpoint was than did those who received statins later. And I think that's a pretty decent conclusion. So when you begin to write, if you have writer's block, just write down these 4 questions, and it will help you write an abstract. What is the purpose of the report? What did you do? What was your hypothesis? And what did you do to find out if it's true? And then when you did the methods, what did you learn? And for every method, you want to have a result. And then what is the importance or implication of your findings? I like this quote. It comes from a poet. I was a literature major, so I like to put poetry in all my presentations. But I think it goes along with what you're doing when you write an abstract. And this is from W.H. Auden. I always have 2 things in my head. I always have the theme and the form. The form looks for the theme looks for the form, and when they come together, you're able to write. So thank you all for coming today, and I think we may have some time to take questions.